fetal alcohol syndrome, there's a picture in the book of kind of, you can see, typically there's facial features that are kind of distinctive, but even lower levels like of alcohol use that don't lead to facial abnormalities can lead to these kind of behavioral things that they talked about, the central nervous system, how reactive these kids are. And you know, you think about previous generations, where definitely our intelligence about kind of prenatal health is a lot higher now than say 40 years ago, but probably likely, you know, especially with cigarette smoking, and a lot of video, shorter video on cigarette smoking now, you know, the health of our fetuses are probably a lot better than they were before, but a lot of kids probably were having troubles, you know, without the parents maybe fully understanding that their use of alcohol or cigarettes or other things prenatally were affecting their kids. And obviously they seem like pretty good parents, right? Really temperamentally easy and good, and you know, but you can imagine it's a handful for them to handle this kid. These things that they're talking about, central nervous system, I mean, you know, it's not that if you see that in a child, that means that there was alcohol use prenatally. You don't know that. You know, some of those things they were describing are similar to autistic type behaviors or even normal kids, and it doesn't necessarily mean there was, you know, fetal alcohol syndrome or even substantial alcohol use. So it's not diagnostic if you see this in a kid, but it is more prevalent in kids who have had this.
What about like countries in Europe where alcohol with dinner and things like that? I mean, I don't think women necessarily just stop, and it doesn't seem to be such an issue as it is here, or if it's not.
Well, you don't know whether it is or not. Again, it's hard to tell once the kid is, you know, born, whether it's because of the, I mean, impossible to tell whether it's because of the effects of alcohol or not. But it is the case that you're right. It is in different cultures more, like that was a good example, having a glass of wine with dinner, for example, and you know, like I said, medical science here in America, these well, and pretty much the world over, as far as I know, including in Europe, is discouraging alcohol use, even kind of moderate amounts of alcohol use during pregnancy, because it's hard to. And the other thing is that question raises is the same levels of alcohol or cigarette using or whatever, cocaine, won't necessarily have the same effect on. So one person might be fine drinking one glass of wine a night, and you don't really know if that's going to lead to negative outcomes for the kid. So it could be okay, but you know, it is a risk factor, what's called a risk factor, meaning it's putting the kid at risk. Just a quicker video from CNN here about smoking and prenatal health.
Are present in the placenta, and they pass into the bloodstream. These researchers found direct evidence that a developing baby actually metabolizes those byproducts.
When the mother smokes, a carcinogen passes into the fetus.
Researchers examined the urine in newborn babies and found 22 out of 31 women who smoked passed on a chemical called NNK to their babies. NNK is a known cancer-causing agent. When we see these chemicals in the urine of a developing fetus, it tells us the baby is getting these chemicals in the bloodstream and breaking them down in the body. It's as if the fetus was smoking itself.
The more the mother smokes, the more likely that the fetus is going to be exposed to constituents of tobacco smoke.
There are many well-established risks with smoking and pregnancy. Low birth weight is very well known. There's also an increase in infant mortality, especially during the first month of life. There's also an increased risk of sudden infant death syndrome, or SIDS, and women can have complications in the 20 to 36 weeks of pregnancy. There's also long-term complications like short stature, meaning children may not grow as tall as they normally would, and they have low reading scores and difficulty with academics. This is just another reason why women shouldn't smoke during pregnancy. Dr. Steve Salvatore, CNN, New York.
Okay, so again, smoking, especially back in the 50s in America, America is pretty smoke-free compared to Europe now. But back in the 50s and early 60s in America, certainly smoking was very prevalent. So again, you just don't know. People have speculated about whole generations of whether kids who were maybe a little bit more not as well regulated, meaning kind of impulse control because of effects of smoking, or not. You don't really know, but it's quite possible.